Good afternoon, everybody. Thank you all so much for joining us today on such a rainy Friday. We are so glad you're here. But before we get started, we wanted to know just a few housekeeping points. To avoid background noise, all participants will be muted for the duration of the webinar. We'll be addressing questions at the end, so if you have any questions as the webinar continues, please enter them into the questions box, which is located on the right-hand side of your screen if viewing from a computer, or at the bottom of your screen if you're viewing from a phone or tablet. If you have any comments or concerns during the webinar, please also enter those into the questions box. I will be reviewing and addressing any immediate needs as they occur. A recording of this webinar will also be emailed to each registrant tomorrow. The recording will also be available on our website at namimd.org for any individuals that were unable to register today. After the webinar, you'll be asked to complete a short survey on the aspects that you felt were helpful, could be improved, and what you would like to see in future advocacy webinars. And now I will hand it over to our Compass team.
Wonderful. Thank you so much, Danielle. Good afternoon, everyone. Thanks for hopping on today. We are a little over 2 weeks post-session down here in Annapolis, so we have all luckily had a chance to catch our breath and get geared up for our work in the interim. For those of you that don't know me, my name is Morgan Mills, and I'm the Director of Government Relations at Compass Advocacy, and I'm one of the lobbyists for NAMI Maryland. Joining me is Josh Howe, who is a partner at Compass Advocacy, and is also part of your lobbying team. So we just wanted to take some time today to reflect on this session. It was a huge year for behavioral health, and it was really rewarding to have the honor of working on these issues for all of you. So in the state of Maryland, we have a 90-day legislative session, which means we have 90 days to get everything over the finish line. Session runs from mid-January to mid-April every year. And so anything that doesn't get passed out of both chambers, the House and the Senate, by sine die or the last day of session is effectively dead, and the process has to start all over again next year if the bill were to be reintroduced. So it's very fast-paced and quite a lot to accomplish in only 90 days. This year especially was very unique. We had 50 brand new legislators. We had a brand new administration, so a new governor, Governor Wes Moore, a new lieutenant governor, Aruna Miller, as well as a new comptroller, a new attorney general. So this year was definitely unique in that, there were a lot of fresh faces, a lot of new legislators to work with. This session, over 2,000 bills were introduced. So it was a very busy year. Obviously, not every bill makes it to the finish line, but with over 2,000 bills introduced and so many new faces, it was really unique and honestly a lot of fun. Earlier in February, we hosted our annual virtual advocacy day, which has been a huge hit in the legislature. Over 150 NAMI volunteers participated in meetings throughout the day with around 50 legislators. It all went incredibly smoothly thanks to the work of the affiliate leaders who helped rally the troops of their individual affiliates. We were able to get so many advocates talking to their legislators about mental health and their personal experiences. If you happen to be on the Advocacy Day preparation webinar, you may recall my colleague Rob Garagiola sharing that curating personal relationships with your legislators is key. And so, having the opportunity to match constituents with their elected officials and opening up the opportunity for a dialogue about mental health in the state was so important and so beneficial to crafting policy. This year, we also saw our elected officials across the aisle really open up about their own personal experience with mental health, their family members' personal experience, and I think that really speaks to how we're destigmatizing these conversations and allowing them to be had in a way that is productive and real. And that's a huge step in and of itself, right? The Senate of Maryland actually curated a bipartisan behavioral health package this year, which consisted of 7 bills, a handful of which were aligned with NAMI priority bills. But we're really starting to see this shift in importance placed on Marylanders' behavioral health needs and how to figure out the best ways to address those. Additionally, this session, we amplified our grassroots advocacy efforts. with the creation of a new action alert system. I'm sure many of you got the emails and hopefully utilized the take action buttons, which allowed you to fill out your name and address, and then it would generate a pre-written message encouraging legislative support for certain initiatives. Because of all of you all and your efforts, almost 3,000 emails were sent to General Assembly members regarding 5 of our priority bills. So 700 of you took action and helped support NAMI priorities and made it known to our legislators that these issues are important and people are paying attention. Um, this action alert was a huge success and made it really easy to disseminate that information to our lawmakers. Of course, you could edit the message as needed. So you could add a line about your own personal experience in there if you felt inclined to. That does really resonate with folks. I used to be a staffer, and I can tell you that one of my daily tasks was going through our email inbox and seeing what issues people in our district were reaching out to us about, and making notes on my little Excel spreadsheet and reporting back to my delegate what is of importance to her constituency. So generating this huge flood of emails is so important. It makes a difference. It helps legislators form opinions on what they will and won't support. And I personally am really incredibly pleased with how these action alerts turned out for us. And truthfully, it's really because of advocates like you that take the time out of your days to make it known that these issues really, really do matter to Marylanders. So with all of that being said, we can get into our priority bills and where the chips fell this session. We had a super, super successful session. So we will start with 988 funding. That was Senate Bill 3, House Bill 271. Funding for 988 was actually the first bill to pass out of the Senate this session. It passed unanimously both in the House and Senate. And what that bill did was secured an additional $7 million in funding for the 988 Trust Fund for the upcoming fiscal year 2025. So that brought us up to a total of $12 million in funding. That money will be used for crisis call centers, mobile crisis services, crisis stabilization centers, and other acute behavioral health care needs. This was a one-time allotment of funds, so there is still work to be done in finding a steady funding stream, but securing $12 million to continue operation of this super critical, super important work, it was monumental, and we are able to keep this program running. The next bill I will be discussing is step therapy. You might know it as Fail First. There was a bill revisiting what that protocol looks like. And so this bill established a standardized process for providers to request exemptions from step therapy treatments. If you happen to not know what that is, step therapy or Fail First is when your insurance company has you try a certain medication and then you have to fail out of it to get to the next step. Typically, that leads to prolonged periods where you're not getting the medicine you actually need because insurance companies are trying to give you a generic version or a different version and forcing you to go through this whole process before actually getting you to the medication that you need. This goes for somatic and behavioral health care, though it is more often seen in behavioral health context. But this bill passed the Senate and the House, headed to the governor's desk for a signature. It established a protocol for your healthcare provider to request an exemption from Fail First protocol. As originally written, the bill would have provided an automatic exemption for treatment related to serious mental illness. Unfortunately, that got amended out, but the House Health and Government Operations Committee is establishing a work group in this interim to study the feasibility of that automatic exemption. And so that is something we will be seeing again in the 2024 session. So even though that automatic exemption was amended out, we did at least get a process established so providers can request a Fail First exemption, which is a step in the right direction and definitely a win. Additionally, this session, we advocated for Medicaid reimbursement for services provided in a school setting. Unfortunately, that bill did not make it to the finish line. it would have required the Department of Health to apply to the Centers for Medicare and Medicaid Services to get a state plan amendment, and that would have authorized reimbursement of behavioral health services that were provided in a school setting. There was so much work put into this bill to build support with the Department of Health and other agencies, and honestly, most of the issues were resolved. We did not have time to get a vote in the House or Senate this year. That being said, we do believe this issue is primed for enactment in 2024. And in addition to that, we're continuing to work with the Department of Health to gauge their interest in proceeding with the state plan amendment over this interim when the General Assembly is not in session, because the Department of Health can still apply for the state amendment without the legislature directing them to do so. This bill just would have made it so they had to. But we will be working with them over the interim to see if a pathway without legislative direction is something that the department may be interested in taking. We also lobbied for Senate Bill 480, House Bill 823, which would have enabled counties to establish an assisted outpatient treatment program that would have been in coordination with local behavioral health authorities. This was a controversial bill. It had been introduced in the General Assembly for probably the past 15 or 20 years at this point, never really getting too far. And there's definitely been some concerns surrounding AOT programs, but the chairwoman of the House Health and Government Operations Committee convened a work group of proponents and opponents to work through the bill, quite literally line by line, to make sure everyone was accepting and agreeing on what this program could look like. And so after hours and hours of negotiations, with NAMI being a huge proponent, Josh helped to lead those conversations, we got to a bill we were all pleased with. It was voted out of the House unanimously, but again, due to time restrictions, the Senate was unable to take up this amended version. And so ultimately, we just ran out of time on this bill. I mean, we only have 90 days, which might seem like a long time, but when you're in the middle of it, it is not a long time at all. But getting this bill voted unanimously out of the House was an incredible accomplishment. Absolutely sets the stage for enactment during 2024. Like I said, this is the furthest this bill has ever gotten. We have a huge advocate for these programs as the chair of the Health and Government Operations Committee, which is the committee of jurisdiction. The chairwoman told us the bill is going to be pre-filed and will be heard in a timely manner so we can make sure we have enough time to get this bill over the finish line next year. Treatment plan revisions, which was SB 8 or HB 121, that passed, headed to the governor's desk for a signature, basically requiring treatment plans for people that are admitted to a facility have to charge a discharge goal, an estimate of how long they foresee you staying there, recurring faculty review of treatment plans, and then at least extending an offer for family member participation. So like I said, that bill passed, also being sent to the governor for his signature, as is the behavioral health treatment and access model. This bill established a commission on behavioral healthcare treatment and access of about, I want to say, probably 30 folks who will convene to make recommendations to provide appropriate, accessible, and comprehensive behavioral health services in the state. A representative of NAMI Maryland is included as a member of this commission. This bill also established the Behavioral Healthcare Coordination Value-Based Purchasing Pilot Program. That was a mouthful, but basically that rewards quality of service over quantity. And then finally, this bill also extended the coverage of audio-only telephone conversations in the definition of telehealth in the Maryland Medical Assistance Program. So this bill was a vast bill. It was very comprehensive, but we are very pleased at its passage. And then finally, for NAMI priority bills, a program regarding youth wraparound services was approved and headed to the governor's desk. The bill basically required the Department of Health to expand access and provide reimbursement services for certain wraparound, in-home case management care services. It also required that beginning fiscal year 24, the BHA, the Behavioral Health Administration, fund 100 slots in the mental health case management program for children or youth that are at risk of out-of-home placement. And they are not already eligible for those program services. So, we're really opening up some eligibility for those who need it most. That bill, again, a priority for us, headed to the governor's desk, and was also a part of the Senate's behavioral health package, which I talked about earlier. So a huge success for NAMI Maryland priority bills. Out of the seven priority bills that we had, 5 of them are headed to the governor's desk for signature. 2 of them just barely didn't make it over the finish line, but are absolutely set for enactment in this 2024 session. So a huge success for us. In addition to 988 funding, the treatment and access model and wraparound services that I just talked about, the Senate Behavioral Health Package also included codifying the Collaborative Care Pilot Program as a permanent program, the Telehealth Sunset Extension Act, which extended audio-only services to be covered through 2025, establishment of community behavioral health clinics and a way to fund those, and then finally, value-based purchasing pilots. All of those are being sent to the governor for a signature. So, all of that is to say we have had an extremely successful session. The very few of our bills, again, that didn't quite make it over the finish line are set to be reintroduced. Absolutely have a strong passage, have a strong chance of passage next session. And so, definitely a great year for NAMI, a huge year for behavioral health in general. And I surely hope that you all feel as proud as I do of these successes, because we are making great strides in our state. And so with that, I know I kind of ran through that pretty quickly, but I will take any questions if there are any. Thank you all so much.
And again, if you have any questions, be sure to submit them in that questions box that's at the bottom of your screen if you are viewing from a computer or a laptop, or on the left-hand side of, or right-hand side of the screen if you're viewing from a phone or a tablet. We've gotten some tech issues, but don't worry, guys, everything here is recorded, and I will be working with Morgan and the Compass team to get a written report out to y'all as well, just in case there are any audio issues, video issues from anybody else. Andrea asks, for those of us engaged in advocacy with NAMI and Mental Health Association of Maryland, is there a way to work with both?
I'd say absolutely. For those who don't know me, I'm Josh Howe. I work with the NAMI team in addition to with Morgan, Rob Yargiola, and Addison Pruitt with Compass. So NAMI does participate in the Maryland Mental Health Association work groups, as well as the Behavioral Health Coalition, as well as many other stakeholder organizations and work groups that have either been established by statute or agency work groups, such as under the Maryland Department of Health, Behavioral Health Administration, and even kind of more quasi-informal groups of various other stakeholders and coalitions. And so that is something that we definitely see that is possible, working with NAMI and with other stakeholders. If you have, specific questions on how to kind of get engaged, I'd encourage you to reach out to the NAMI executive team, or you can reach out to the Compass team directly, and we'll make sure that you have that contact information available to you in the follow-up.
Yeah, and I just put in the email our advocacy@namimd.org account that is monitored by both the NAMI team and the Compass team. So if you guys have any questions that you don't get answered today, definitely send it there. Alfred asks, a spreadsheet delineating the bills, for example, the numbers, synopsis of content, etc., posted to the website would be helpful. Is that something we can provide, Morgan and Josh?
Yeah, so we definitely have a Word document that goes over and summarizes a majority of what Morgan has gone over today. So we'll include that. We also have an Excel document with links to the General Assembly website that shows all sorts of information. But the Excel document also summarizes the bills pretty eloquently, kind of shows where they passed or where they got hung up in various committees or various stages of the parliamentary process. We can definitely distribute that. We'll kind of defer to NAMI on posting that to the website, but that's something that we can definitely provide for participants today.
Awesome. And unless there's any other issues, I'm sure we can post it to the website. But Lisa asks, any idea what the priorities will be for next year's legislative session, or is it too early to ask this?
So I like where the question is coming from. We are excited to kind of get planning for next session as well. So many of the legislators are, on vacation. They're in the islands. They're, with family. So I would say at least until about July or August, we would be meeting with affiliates and we'd be soliciting ideas from NAMI's membership for what should be addressed. We're also going to be working and communicating with the Governor Moore administration, the Secretary of Health, Behavioral Health Administration over the next couple months. So there's also a lot of bills that are going to be implemented. And so we plan to kind of take a look at everything that's been passed, everything that's been done, new programming that'll be coming to the state, and kind of taking another deeper dive look at, a gaps analysis of, so we've made progress on these things, where can we make progress in the future? So I would say that a lot of the priorities will be set in the fall of this year. And to the extent that, you have ideas or, your affiliate has ideas of things that need to be addressed, we'd love to hear them. So I think Danielle shared the advocacy contact, and we'll be reviewing all those. And as we begin preparing for next session, next January, that fall time frame is when those priorities are going to get solidified.
Andrea asks, anyone leading on mental health parity?
I think that's Morgan, right?
Yeah, so we are a part of the Legal Action Center's Parity Coalition. We are actually convening on Tuesday of next week with several different stakeholders, and going to be planning our legislative agenda for the upcoming session, and kind of just brainstorming and reviewing what this session looked like. So we are working with the Parity Coalition. We are a member of the Maryland Parity Coalition. And again, I feel they are in a similar boat as us, as we're just kind of going to review and start to level set on what next session's parity priorities will be.
Awesome. Ron says, thank you for this excellent summary. Is there anything advocates can do to advance the AOT bill during this period when the legislature is not in session? There is so much misunderstanding about AOT and what that bill would actually entail.
Yes, so over the interim, over the next 6, 7, 8 months leading up to next session, the Compass team, in coordination with the NAMI Maryland executive team, will be convening meetings with the affiliate leaders from all of the affiliate NAMI local agent affiliates, and we'll be communicating on a pretty consistent schedule on those types of engagement with legislators. Again, I think the fall is a good time to be reaching out to legislators and meeting with them in a less stressful non-session environment. So speaking with legislators, specifically your legislator, about AOT in that time frame would definitely be helpful. I would just note that the bill has already gone through the House Health and Government Operations Committee. It's gone through the House of Delegates at whole. So we'll be focusing on educating members of the Senate, and specifically the Senate Finance Committee, on the merits of AOT. And again, just kind of going back to Morgan's summary, there was a lot of work put into the AOT bill to get it to where it passed out of the House of Delegates. Concerned stakeholders from many different organizations, including the Office of the Public Defender, On Our Own Maryland, Mental Health Association of Maryland, all spent a lot of time and effort to get the bill in a space that improves, establishes, would allow for the establishment of an AOT program while protecting patient rights, and really uses a lot of other legislation from across the nation, specifically the New York AOT model, to base what Maryland's AOT program could look like. So I would say, again, in the fall is when we want to begin to meet with legislators, and we'll be meeting with the affiliates to kind of help coordinate and facilitate that outreach. If you are interested in meeting with your legislator, please, let your affiliate heads know, and even us, so we can just kind of be aware of what legislative conversations are occurring and who is getting that type of education.
Awesome. Judy had a question. Do you know when the Moore administration will finalize the mental health leadership team?
So that's something that a lot of stakeholders and people that are attempting to insert ideas into government are asking. The Wes Moore administration has been slow and thoughtful when it comes to establishing their leaders and agency secretaries and leadership. At this point, I don't even believe we have a new secretary of deputy secretary of behavioral health administration. We do plan to meet NAMI Maryland, and representatives from NAMI Maryland and the Compass team do plan to meet with the Maryland Department of Health secretary soon, as well as the budget team, the budget secretary soon. So we will be, trying to find that information out. But, given that the governor was sworn in, the second week of session, they had a lot to do to get their budget passed, to get some of their priorities passed. I think that now that we're outside of that intensive session window, the Moore administration will be able to focus on establishing, those leadership teams, specifically when it comes to mental health. So stay posted. We'll keep that in. As we, determine that information, we'll definitely share it. But right now, the answer is we're not quite sure.
Okay, I don't see any other questions that aren't already answered. So we'll give it another minute or so for any of those last minute questions. I think while we're waiting, a general question would be, Morgan and Josh, what can folks expect in the next couple of months from NAMI Advocacy and Compass?
So as I kind of mentioned, there is a group of affiliate leaders that will be meeting with the Compass team over the interim on a consistent schedule. So we will be discussing a number of different topics, including, what NAMI's priorities will be in the upcoming session. So, a lot of credit to the NAMI Maryland executive team, Kate, Danielle, Jeff, others, always are thinking about ways to engage, the fullest extent of what NAMI is, which is, you all and your members. So we will be discussing ways to engage over the next months, specifically the fall time frame. I think we're going to be coordinating and facilitating meetings, NAMI members and their elected officials through those affiliate leadership meetings. So there won't be too much in the summer time frame, as a lot of legislators are on vacation or working their jobs or with their families. But I would say in the July, August time frame is when we're going to get back up and running, and really trying to make sure that your legislators are hearing from you. So just kind of stay posted for that time frame, and I'm sure there's going to be plenty of opportunity for engagement.
Awesome. And looks like we've got one final question from Lori, who says, who are the mental health champions, and who are those opposed to any additional funding or support?
Our mental health champions would definitely be Delegate Lord Charkoudian from District 20, Tacoma Park. We have Senator Malcolm Augustine from Prince George's County in the Senate. There are other members, such as Chairwoman Jocelyn Pena-Melnick from Health and Government Operations, who chairs that committee. Delegate Steve Johnson, who has done a lot of work on, step therapy and things like that. I don't think there are many opponents to mental health improvement in the state. And I'll just kind of leave it at that. I can't really think of anybody who opposes these initiatives. I do think that if something, is not getting funded, it's because there's a thought that, it's detracting from other priorities. And that's the only reason that some things are not getting funded, is because there's just not enough to go around. I hope that kind of answers your question.
Yep, and I don't see any other questions. So we're going to go ahead and wrap up. Again, if you have any questions after this webinar, feel free to send that over to advocacy@namimd.org. Like I said, it is monitored by both NAMI staff and Compass staff, so feel free to send any questions there. But first and foremost, thank you for joining us this afternoon, and thank you to the Compass team for your time and expertise. As a reminder, this webinar has been recorded and will be emailed to all registrants tomorrow. We hope that this webinar has been helpful for you this afternoon. At the end, you'll be asked to complete a short survey on the aspects that you thought were helpful. But also, don't forget, you're invited to join us on Saturday, May 20th at 9 a.m. for our 2023 NAMI Walks Maryland. Please feel free to join us for a United Day of Hope at Rashfield Park at the Inner Harbor in Baltimore. If you've ever taken part in this inspirational and celebratory event, you know you're making a difference step by step. Each person who laces up or supports a participant is raising important funds to help the 1 in 5 people who are impacted by a mental health condition, and helps us fund our year-round free mental health support, education, and advocacy efforts like these. If you would like to learn more about NAMI Walks Maryland, you can go online or register for free at namiwalks.org/Maryland, or you can reach out to me directly, Danielle Fletcher at dfletcher@namimd.org. We wish you all a safe and healthy rest of your week, and please don't hesitate to reach out to us through our website at namimd.org or by phone at 410-884-8691 should you need any additional resources or support. Have a great rest of your day and enjoy your weekend.